yesterday, in fact, we learned that we have passed as a country a critical threshold point. There are now more Canadians over the age of 65 than there are under the age of 15. Stephen Harper and the Conservatives have had 10 years to plan for this fundamental shift that everyone saw coming, and yet they've done nothing. They didn't even try. Our grandparents and parents built this system for us, built a healthcare system that is the envy of the world. And we owe it to our kids and grandkids to ensure that it remains sustainable and healthy long into the future. The best way to make that happen is to prepare our healthcare for the demographic shift that is happening right now, which means making modern, excellent care outside of an institutional setting accessible and available for as long as possible in a person's life. And I've watched our provinces do that without any help or support from the federal government. We know that money is extremely important in the future of our healthcare system, but leadership and partnership with the federal government is also extremely important. And that lack of leadership that we've seen for many years has hurt not just our system, but individual Canadians. We are committed to renegotiating, to re-engaging on the healthcare accords, on the Canada Health Transfer with the provinces by sitting down, and we were bringing to the table $3 billion for something that has been a priority for provinces and for Canadians, which is greater investments in home care to ensure that Canadians can have a greater quality of life at the same time as we're not going through the institutional model that is a much more expensive and much less efficient in terms of quality of life for Canadians.